Global interruptions in HIV prevention and treatment services as a result of the response to COVID-19. These are results from a social media-based sample of men who have sex with men. I have no conflicts of interest to disclose. Briefly, I plan to open with a few details on the goal of this analysis, discuss the available data sources and methods used, and finally discuss the main findings and implications for service delivery. As we now are beginning to understand, efforts to curb the spread of COVID-19 have successfully slowed the growth of new cases. These mitigation strategies have also resulted in unprecedented disruptions to society, and the impact of these strategies on routine healthcare delivery is still largely unknown. Gay men and other men who have sex with men may be particularly vulnerable, as these mitigation strategies consistently appear to exacerbate existing disparities. The objective of these analyses was to assess the relationship between the stringency of COVID-19 mitigation strategies and interruptions to HIV prevention and treatment services. Data for this study were collected through Hornet, a free gay social networking app with over 25 million global users and 4 million active users. Hornet is the #1 app for gay men in France, Russia, Brazil, Turkey, and Taiwan, and is rapidly expanding elsewhere. Hornet serves as a platform not only to connect with others, but also to learn about what's going on in the community at large and share content. Between April 16th and May 4th, 2020, active Hornet users were invited to participate in a survey with a series of questions related to the impact of COVID-19 on a range of economic and health indicators. Hornet users were eligible for this study if they had been active users on the app for at least 1 year. Countries were included in these analyses if they had at least 50 individual responses. A total of 2,134 individuals were included from 10 countries: Brazil, Canada, France, Indonesia, Mexico, Russia, Taiwan, Turkey, the UK, and the United States. Individuals were asked a series of questions related to the effects of COVID-19 on HIV prevention and testing. For HIV prevention measures, all participants, regardless of HIV status, were asked about their access to a series of HIV prevention services, including in-person HIV testing, HIV self-testing, pre-exposure prophylaxis for HIV prevention or PrEP, and condoms. The questions began with the prompt, whether you need these or not, do you feel you have access to HIV prevention strategies during the COVID-19 crisis? In addition to the social media-based survey, data on the stringency of COVID-19 mitigation strategies were obtained from the Oxford COVID-19 Government Response Tracker. This tool collates information on indicators of government responses, and these indicators relate to containment and closure, economic policies, and health system policies. These indicators are then aggregated to create different indices to measure government action. Here we show the Government Response Stringency Index. This index is based on 9 of the 17 available indicators, primarily related to containment and closure, as well as one of the health systems indicators. Based on an aggregation of scores on the various indicators, countries receive a score of between 0 and 100 on the Government Response Stringency Index. Given that the survey responses were obtained between April 16th and May 4th, stringency scores assigned were based on government responses recorded as of April 6th, and different dates of recorded government responses were tested in sensitivity analyses. So zooming in here on the countries that were included in our analyses, stringency of government response scores for April 6th ranged in value from 27.78 for Taiwan to 90.74 for France. And the effect of country-level stringency on access to HIV prevention services was estimated using GEE Poisson regression with robust variance, accounting for within-country correlation of observations. Among included men, the mean age was 38 years old, with older men being from Canada and the United States. 18% of the sample were living with HIV, and 13% reported having no health insurance whatsoever. 57% reported some interruptions in in-person testing, 56% for HIV self-testing, 55% for PrEP, and 14% for condoms. So looking at the results from our regression analyses, for every 10-point increase in the stringency of the government response to COVID-19, there was a 10% reduction in access to in-person testing, a 9% reduction in access to PrEP, a 2% reduction in access to HIV self-testing, and a 6% reduction in access to condoms. More stringent government responses were associated with decreased access to HIV services. Innovative strategies like mobile service delivery or telehealth may be needed to minimize the service interruptions from these types of government responses on MSM communities and ensure continuity of care. Thank you for your time and attention. I'd like to thank all our collaborators on this work, the COVID LGBT Disparities Working Group, the folks over at Oxford who created the government response tracker, and to all the participants. Thank you.